I'm Dr. Larry Santora. Thank you for watching Heart, Health, and Home. This week we're going to talk about supplements and how they may protect you from the COVID virus. And then we're going to have a report from Nicole Johnson about Medicare and insurance issues. And then we're going to hear from Maria Sanchez, who's a real estate expert, and talk about the real estate market in Southern California as it has been impacted by COVID. I said in the past, in other podcasts, that the biggest risk factors for an adverse outcome from the COVID virus is being obese, diabetes, lung disease, and heart disease. There are ways that we could change the obesity with exercise. We can cut down diabetes with exercise and diet. And COPD can be improved by stopping smoking. And your heart disease does not put you at a real adverse risk unless you just had a recent heart attack or you have congestive heart failure. So there are supplements that may be beneficial, and one of them is vitamin D. It seems that when studies were done on those who had the worst outcome from COVID, they had low vitamin D levels. Now, vitamin D is made in the skin, and when it's exposed to ultraviolet light and sunlight, and it's converted into the active form, which is vitamin D3. So it's simple to take vitamin D3. It's very inexpensive. Usually 2,000 units per day would be a reasonable amount to take. It has very few side effects. The second thing that may benefit you is zinc. The zinc sulfate has been the usual form of zinc that is available. 220 milligrams of zinc sulfate per day may prevent the replication and the adherence of the virus to the lung lining, the alveoli, which are the air sacs, and it may cut down the ability of the virus to adhere to the air sacs. Another thing that I think is worthwhile is taking a magnesium supplement. And the reason why I say that is that when people have a stress on their heart, whether it's from a virus or a cold or pneumonia, they tend to get abnormal heart rhythms. And the most common type of abnormal heart rhythm is atrial fibrillation, where the top chambers go out of sync with the bottom chambers and the heart beats fast and irregular. Magnesium has been very effective in preventing the onset of atrial fibrillation. Not 100%, but it certainly can reduce the chance of that occurring. And there's various types of magnesium. It's a mineral that you can buy in the drugstore. The one that, in my experience over the past 35 years, seems to work best is Magnesium Chloride. And the brand that I tend to use is called Slow Mag, S-L-O-W, Mag, M-A-G. The generic form is Mag 64. Only comes in one dosage size. If you have no symptoms, maybe taking one a day. If you start to have symptoms, take 2 or 3 per day. The only downside could be that you may get loose stools, and if you so, you have to back off. Now, I'm giving you these recommendations because these are simple. There's very few side effects. It's inexpensive, so why not do it? But the why not is that you should discuss this with your family physician or your internist and get their approval before you take these supplements. But I think taking these 3 supplements will go a long way in protecting you. If you also exercise, get your weight down, eat a healthy diet, it'll cut down your chances of getting diabetes. If you do have diabetes, make it easier to control. And certainly cutting down food intake and exercising is a cheap way to go, and also advances cardiovascular health. So with that in mind, I wish you well. We'll see you next week. I'm going to pass this on to Nicole Johnson, our health insurance expert, and then our other co-host, Maria Sanchez, will speak about the real estate environment here in Southern California in regards to the COVID virus. Keep well, and we will see you next week. Thank you for watching. I'm Dr. Larry Santora, and this is Heart, Health, and Home.
Hi, I'm Nikki Johnson, a health insurance agent specializing in Medicare. Medicare can be confusing, so I'm here to assist people with questions about Medicare and help them navigate the system. I can help those who are first turning 65, those who are retiring or coming off an employer plan, and even those who have been on Medicare for many years but want to compare their current benefits and update their current plan. Today, I want to discuss prescription drug coverage, also known as Part D. Now, the government requires that once you become eligible for Medicare, you have credible drug coverage. If you don't, you can face a penalty. You can sign up for Part D by applying for an MAPD plan or a Part D prescription drug plan. In order to qualify for a drug plan, you must live in the plan service area, must be entitled to Part A and B, and must not have end-stage renal disease. Each prescription drug plan and MAPD plan must provide at least a standard level of coverage set by Medicare. However, each plan can vary on which pharmacies they use, which prescription drugs they cover, and how much they'll charge. There are 4 stages to drug coverage set by Medicare, and many of you have probably heard of the donut hole, also known as gap coverage. If you have any questions about these different stages, the donut hole, or your current drug coverage plan, I'd be happy to offer you a free drug analysis of your current medications and benefits and where the donut hole may affect you and your drugs throughout the year. Many people are not aware that the government offers a program for prescription drugs called LIS, Low Income Subsidy, Extra Help. You can apply online at socialsecurity.gov or call Social Security over the phone to apply or request an application. LIS Extra Help is different than Medicaid, and it's different than Medicare savings programs and designed specifically to help with the cost of your medications. Any questions or concerns, please reach out to me via email, phone, or text at the number listed below on the screen. Until next time.
Hello, my name is Mary Sanchez. I specialize in residential real estate here in Orange County. I am with Coldwell Banker of Newport Beach, and welcome. So today I wanted to talk a little bit about what is going on currently in our housing market and how it has compared to past years. So starting with June of this year and comparing to June of last year, we had 40% more homes on the market last year than this year already. And needless to say that though our housing supply is at its lowest it's been since June of 2013, we need to keep in mind that the only 2 out of the 5 recessions actually impacted the housing and were led by housing. We remember that the effects of the recession because it occurred not too long ago, and there's a belief that every recession should pan out the same way. And in reality, we need to understand that this is more of a pandemic. It's not led by housing, but by a pandemic event where we have the support of our government to alleviate and bridge the gap by providing unemployment assistance and help small business owners get back on their feet as soon as it is safe for everyone to do so. So these are all things that we want to keep in mind as we see the housing market and how it is actually gaining some momentum as each week passes. So with this said, I would like to give you a comparison of our market update here in Orange County. So for the month of May, we saw 1,884 new listings placed on the multiple listing services. In comparison to April, those numbers were 787 new active listings. So we are seeing over double the amount of new active listings for the month of May. We had 1,268 properties that moved under contract in comparison to 115 in April. That's approximately 11 more times the amount of properties that moved under contract in the month of May. We had 744 new properties that moved into pending status and 1,353 properties that closed here in Orange County in May. So from the slowdown that occurred in the past months, we are looking at a steady upswing in the housing market. And while the interest rates are at record low, people are starting to head back to work and resume a more normal, healthy lifestyle. And it just appears that our market is starting to recover. And so if you would like any more information for your specific area, please contact me and I will be more than happy to help in any way I can. Thank you, and be well.
I'm Dr. Larry Santora. Thanks for watching Heart, Health, and Home. Do I have a deal for you? For free, you will get 2 items that will potentially save your life. The first one is this book that I wrote on coronary calcium screening with Dick Butkus, NFL player. This will tell you a lot about heart disease and tell you about the single most important test in medicine, which is a coronary calcium screening test on an electron beam CT scan. I will send this to you for free to the first 50 people who write into Heart, Health, and Home at yahoo.com. And we will also give you this fantastic mask. You know, I wear this mask all the time. This is made of cloth. It's washable, it's breathable, it's much more comfortable than the other types of masks. And we have various colors. We're willing to send you these masks with the book for the first 50 people who write into our email address, hearthealthandhome@yahoo.com. Thanks so much for watching our show today. And if you have any comments or questions, please include those with your email. And we look forward to seeing you the next time. Stay well and stay healthy. And remember, we will all get through this together. Thanks for watching.